Telmisartan is a medication used to treat high blood pressure, also known as hypertension. By lowering high blood pressure, it helps prevent strokes, heart attacks, and kidney problems. Telmisartan belongs to a class of drugs called angiotensin receptor blockers, ARBs, which work by relaxing blood vessels so that blood can flow more easily. For the best results, telmisartan should be taken regularly as prescribed by a doctor. The recommended daily dosage varies depending on the individual's condition, so it's important to follow the doctor's instructions. It can be taken with or without food, but it's best to take it at the same time every day. This will help maintain a consistent level of the medication in the body. When taking telmisartan, it's important to follow the instructions provided by your doctor or pharmacist. You can take this medication with or without food, usually once a day. The dosage will be determined based on your medical condition and how you respond to the treatment. It's important to take telmisartan regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. Keep taking this medication even if you feel well, as most people with high blood pressure do not feel sick. It may take up to 4 weeks before you experience the full benefit of this drug for high blood pressure treatment. If your condition does not improve or worsens, such as if your blood pressure readings remain high or increase, be sure to inform your doctor. As your body gets used to telmisartan, you may experience dizziness or lightheadedness. If this happens, make sure to tell your doctor or pharmacist. To reduce the risk of these side effects, try getting up slowly when you go from sitting or lying down to standing. Your doctor prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who take telmisartan don't experience serious side effects. However, if you notice any fainting or symptoms of high potassium levels, such as muscle weakness or an irregular heartbeat, tell your doctor right away. Telmisartan may be used to prevent or treat kidney problems, but it can also rarely cause or worsen serious kidney issues. Your doctor will monitor your kidney function while you're taking this medication, and you should let them know if you notice any changes in your urine output. While it's rare, some people may have a serious allergic reaction to telmisartan. If you experience a rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This isn't a complete list of potential side effects, so if you notice anything unusual, be sure to talk to your doctor or pharmacist. And don't forget, in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. If you are pregnant or planning to become pregnant, it is important to avoid taking telmisartan, as it can cause serious harm to an unborn baby. It is crucial to use reliable forms of birth control while taking this medication to prevent pregnancy. If you think you may be pregnant or are planning to become pregnant, it is important to inform your doctor right away. Before taking telmisartan, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, be sure to let them know about your medical history, especially if you have liver disease, bile duct blockage, high potassium levels, or if you are dehydrated. Telmisartan may cause dizziness, so it's important to avoid alcohol or marijuana as they can make you even more dizzy. Avoid driving or using machinery until you know how this medication affects you. Also, be cautious if you experience excessive sweating, diarrhea, or vomiting, as it may cause lightheadedness. This medication can increase potassium levels, so it's important to consult your doctor before using potassium supplements or salt substitutes containing potassium. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using telmisartan, as it may harm an unborn baby. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware of possible interactions with other medications. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with telmisartan include aliskiren, lithium, and drugs that may increase the level of potassium in the blood. It's also important to be cautious with products that could raise your blood pressure or worsen your heart failure. Speak to your pharmacist about how to use them safely and make sure to ask about any potential interactions with cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. If you or someone else has taken too much telmisartan and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include a fast heartbeat, severe dizziness, or fainting. It's crucial to act quickly in these situations to ensure the best possible outcome. It is important not to share telmisartan with others. While taking this medication, it is recommended to have regular medical tests to monitor kidney function and potassium levels. Make sure to attend all medical and lab appointments and consult your doctor for more details. In addition, lifestyle changes such as stress reduction programs, exercise, and dietary changes may help telmisartan work better. It is recommended to talk to your doctor or pharmacist about lifestyle changes that might benefit you. It is important to have your blood pressure checked regularly while taking telmisartan. You can also learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of telmisartan, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to taking telmisartan, it's important to store it at room temperature, away from light and moisture. Make sure to keep the medication in its original blister pack until you're ready to use it. If it comes in a bottle, keep the container tightly closed. It's also crucial to keep all medications out of reach of children and pets. And when it's time to dispose of the medication, be sure to do so properly. Don't flush it down the toilet or pour it into a drain unless specifically instructed. Instead, consult your pharmacist or local waste disposal company for the safest way to get rid of it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.